To this now, the recent Ebola outbreak in the Democratic Republic of the Congo has placed renewed attention on infectious diseases preparedness across the African continent. Now, although South Africa currently has no reported Ebola cases, the outbreak presents an opportunity to explore the country's surveillance systems, laboratory capacity and emergency response measures. Now, senior researcher at the Council for Scientific and Industrial Research, Dr. Kelvin Mpofu, joins us more on this conversation. Dr. Mpofu, thank you so much for your time. Now, we've just heard that although South Africa has no confirmed Ebola cases, just how prepared is a country to detect and respond to a potentially imported case?
Good evening, Lupang, and good evening to your viewers. So in terms of South Africa's stance, South Africa tends to be quite well prepared in terms of disease detection and in terms of such cases of disease outbreak. But of course, with Ebola is not one of those diseases which we are typically exposed to, and also due to the lack of to very low number of cases in the country, we typically don't have as high of preparedness as other most affected countries would have. But in terms of developing technologies for such disease outbreaks, the CSIR is developing a wide range of technologies, particularly machine learning based technologies, which we are looking at ensuring that in the event of such outbreaks, we can in fact respond to to any sudden outbreak of a disease. So we do have the critical infrastructure in place. For instance, we do have a wide range of PCR accredited laboratories which can quickly start doing tests for such diseases. I hope that answers.
Dr. Kelvin, yes. Now, speaking of laboratories, what role do South Africa's labs and other facilities and disease surveillance systems play in preventing the spread of the disease? And we're talking about collaboration here. Some of the research that South African research facilities have done to assist particularly the DRC.
So far, so in terms of disease detection broadly, when you look at diseases like HIV, COVID, diseases like HIV, COVID, and TB, South Africa has quite a significant network in place, which allows us to sort of take immediate action across different laboratories in response to an outbreak of such diseases. But with Ebola particularly, because it's not, we haven't been as affected by it as we are by other traditional diseases such as HIV and TB. We have more preparedness for those other alternative diseases as opposed to.
Yeah, and Doctor, you mentioned HIV, and that's really one of the best examples to use because from 20 years compared to today, it is no longer a condition that people really just die from because of the lack of research or because of the lack of access to medication. We also look at COVID-19, for example, where South Africa did exceptionally well, globally so, and as far as having found a strain, rather, and reporting it to the World Health Organization, and that also kind of really backfiring on us. And this just really goes to show the importance as well as the strength of South Africa's medical research and how far it goes, right? Now, and as far as Africa particularly is concerned, how far back are we as compared to countries in the West, for example?
So I, in my personal opinion, would say we're not so far behind, especially in the technology sector. we were seeing, particularly groups in the CSIR, they're looking at developing new technologies. If you think of in the machine learning space, there are people doing research in developing new machine learning based diagnostic products at the CSIR, which allow us to, to be at the forefront of diagnostics in the event of an outbreak. We also have more sophisticated technologies, like in the quantum technology space,
Yeah.
where people are developing a wide range of technologies across the CSIR and other laboratories across the country to try and combat any outbreak across the country. So in terms of in terms of being prepared, I think South Africa is significantly prepared. Of course, we do have gaps here and there that need to be addressed, but we saw even during the COVID outbreak that South Africa had the capacity to come to the fray and demonstrate good capability.
Dr. Kelvin, thank you so much for your time. Very important discussion there with regards to the Ebola outbreak that is currently taking place in the DRC, as well as what South Africa is doing to help in that regard.